Hello, everyone. I love being part of this. This is just an amazing thing. The thing I like the least about this role is having to bring everybody back and stop conversation. However, we have an amazing second group of speakers that I know you're all going to want to hear. And so we're going to jump right in. The second half of our session is Beyond the Surface, Exploring Global Health Dermatology Challenges. And to lead us off for the first, I don't think it's advancing. AV people. Hey, Becca, I don't think it's advancing. But to lead us off, we have Dr. Louise Kaufmann. She is a medical dermatologist at the Schweiger Dermatology Group in Great Neck, New York, who specializes in skin cancer and complex medical dermatology conditions. She was the recipient of a 2023 International Award for Social Responsibility in Dermatology for North America from ILDS and L'Oreal. And she is going to be, she does a lot of work not only in her local community, but has a collaboration in Jamaica. Her slides are just going ahead, and she's going to talk about the outreach that she's been doing there. And we are just so delighted that she came here to speak with us today. So thank you so much. Welcome. There we go.
That's pretty though.
It was
nice.
pretty.
That's pretty.
Thank you.
Pretty. Hello, everyone. Thank you so much for having me today to speak about my project, providing access to dermatological care in rural and underserved areas of Jamaica. I'm also extremely thankful to ILDS and L'Oreal for the 2023 award in social responsibility and their recognition of my project. I work with a completely self-funded group, and with these funds, I was able to continue my work in 2024. As Dr. Ho had up before, a map of Jamaica. Each summer, for a little less than a week, I go to a small town in a rural area called Brandon Hill. It's about 2 to 3 hours from Kingston, which is the capital, depending on the road conditions. I'll never forget the first day of my first clinic in 2016. I got to Brandon Hill and I quickly realized all the challenges that were ahead of me. People were coming in with common problems such as acne, and I had absolutely nothing to give them. So I had to be resourceful and creative, and I had some aspirin, so I crushed aspirin and put it in water and made a salicylic acid wash to give people because they were waiting for hours to see me, and I wanted them all to go home with something. Population of Jamaica is about 3 million people. And the problem with access to care there is the fact that there are not many dermatologists. And the few dermatologists that there are located in the larger cities, mainly in Kingston. And the other problem is that the people living in the poor rural areas cannot afford the cost of a specialist, nor can they afford the cost of the medications. These are photos of Brandon Hill. And as you can see, it's a beautiful area, but very rural. And it has extremely poor access as well, because as you can see, the roads are terrible in that area. You're probably wondering how I picked Brandon Hill. Well, it all started in 2016 when I met Dr. Novlette Davis, who you see in the photo here with me. Dr. Davis is a nurse practitioner in the hospital where I see consults, and she grew up in Brandon Hill. She started the LJDR Davis Foundation in memory of 4 of her siblings that died in Brandon Hill because of extremely poor medical care. The initials of the foundation stand for for her siblings' names: Loretta, Jocelyn, Donald, and Rohan. So each summer since 2013, she goes to Brandon Hill with a group of medical volunteers and provides free medical care and free medication. So in 2016, I was looking for an opportunity like this, so I joined their group. We go to Brandon Hill for a little less than a week every summer, but it takes us all year to get ready. We get donations for medications, for clothing, medical equipment. I get a lot of donations from pharmaceutical companies for over-the-counter products. Then 3 months before we leave, we have to pack everything ourselves into barrels. And then these barrels get loaded onto trucks and then shipped to Kingston. Once they're in Kingston, we have trucks come and pick them up and take them to Brandon Hill. When we arrive in Brandon Hill in July, we set up a pop-up clinic in a school called the Evelyn Mitchell School. The rooms are set up for medical rooms, and in the 4 days that we see patients, we see about 1,200 patients as a group. And in the dermatology department, I see about 250 to 300 patients for the 4 days that I'm there. The rooms are set up for medicine, for pediatrics. We have a pharmacy set up. We have a dentist come with us. And we have a lab for some basic blood tests, as well as EKGs and echoes. And then, of course, there I am. There's my dermatology room. I have one room where I see patients and do some minor procedures. I usually have a few assistants helping me, but no dermatologist. Last year was the first time in 9 years that I had 2 nurse practitioners and a physician's assistant along with me to help, and they were trained in dermatology. So we could see so many more patients, and it was a lot less stressful. The most common disorders that I see are things such as, usually eczema and acne are the most common things. And then because of the hot climate, there's a lot of tinea versicolor, seborrheic dermatitis. There are lots of alopecia, extremity ulcers, keloids, and less commonly psoriasis and neoplasms. In children, the most common thing that I see is eczema, followed by bites, some scabies, but not as much as I had thought, and tinea capitis and tinea corporis. These are some of the patients I saw last summer, and as you can see, by the time they get to me, because of the lack of access to dermatological care, their skin conditions are quite severe. And beside the discomfort these people are suffering, there's also a large social stigma in the way they look. This boy in the lower corner came in to see me, and it was about 100 degrees, and he had a hoodie on and wouldn't look any of us in the eye because he was so ashamed of the way he looked. I'd like to share with you 3 patients that I've seen over the years that illustrate the need for better dermatological care in these rural areas. This is an 8-year-old girl that was being treated by local physicians with a bacterial infection of her scalp. She was getting progressively worse, and by the time I saw her, I thought she had tinea capitis and treated her. I kept in touch with her mother, and over the next few months, she did extremely well and was a happy little girl again and went to school without having to wear her hat. The next patient is a 48-year-old woman who presented with a plaque on her breast for over a year that was being treated locally with some creams. It was getting progressively worse, and she really didn't know what to do by the time I met her. I knew she needed a biopsy, so I'm very thankful to Dr. Ho for arranging her care at the University of West Indies. She was subsequently diagnosed with breast cancer and is being treated and doing well. Lastly, this little girl I met in 2017 with severe atopic dermatitis. She came to the clinic, obviously not looking well at all, and was being treated with some creams by local physicians. And it was a big problem also because the mother had no idea how to take care of her daughter's skin. She had no education on skin care. So over the years, we treated her. I gave her medications, and our group, the foundation, would send her medication during the year. And she did well and was a very outgoing little girl and a happy little girl. She actually sort of became like a mascot for our group because we all became so close to her. Unfortunately, in 2022, she developed pneumonia. And because of the lack of care, access to care in Brandon Hill, she passed away at the age of 7. So my goal is to create a lasting system for better access to dermatological care in this area. I'd like to start by working with doctors at Chapelton Hospital, which is a hospital about an hour and a half away from Brandon Hill. There's a doctor there, Dr. McFarlane, who's an internist, and she's 100% committed in helping me reach my goal. So presently, what we're trying to do to bridge this gap in lack of access to care, she's helped me we've arranged a dermatology clinic that meets for one day at Chapelton Hospital when I'm in Jamaica. And I teach the doctors basic procedures and dermatology when I'm there with her. Hopefully one day this is a clinic that could run on a more continuous basis during the year, not just once a year. That's something I'm hoping will happen one day. We also have a very simple WhatsApp group where we exchange cases during the year, and I teach them dermatology that way. And I'm working on getting an EMR system for our clinic in Brandon Hill that will connect to Chapelton so patients can get continuity of care when I'm not there. For the future, I'm hoping to do a few things, and hopefully one day it'll happen. I think a telemed program would be an excellent way to empower these doctors in the rural communities. If there was some way that they could connect to Jamaican dermatologists, I think it would be very helpful. And I hope one day there could be a collaboration between the University of West Indies and Chapelton Hospital where there'll be better care for the people in that rural area. So how you can help? Well, you could come volunteer with me. I can always use I can use anyone to come help. And these are some pictures of some volunteers that came with me over the last couple of years. And this is my contact information. If anyone wants to reach out to me, I'd love to hear from you. And thank you.